For the first time in history, the federal government will start punishing hospitals that cannot keep Medicare costs down. Hospitals, obviously, outraged. Andrew Rubin from NYU's Langone Medical Center is right here. You run a hospital, don't you?
I do.
And you're being squeezed by the federal government, aren't you?
We are, but this was somewhat predictable because it's the path of least resistance.
You still don't like it, do you?
We don't like it at all, but you know, we knew this was going to happen because the public, you know, we have to cut Medicare costs, right? And the public, as we saw with Representative Ryan's Medicare privatization plan, they don't like it. So what are you going to do? You squeeze the hospitals. So
let's be sure what we're talking about here. The federal government is saying to you, right, you treat a Medicare patient.
Right.
We're going to track that patient. How much are you charging? What is that patient being treated for? And when that patient has left your hospital, you are still on the hook for any aftercare with a private physician.
That's
right?
what's being talked about for 90 days after their
But you're not. How can you be responsible for the cost of treating a Medicare patient who's left your hospital?
Well, we can't be. So what they're going to force us to do, hospitals to do, is invest more money into making sure that we look after our patients once they leave the hospital by hiring our physicians into hospital organizations rather than having them, you know, practice in private practice as they've been doing, you know, for a century. We're going to have to look at new ways to better manage the care of the patient, which may not necessarily be bad for the patient, but it's certainly going to be hard on the hospitals.
So two things are happening here. Number one, you're going to have to pass off these extra costs of Medicare treatment. You have to pass that on to people who go for private sector treatment, right? So people like me, we're going to end up paying more. Is that right?
Well, it's a little secret in the healthcare industry. I mean, Medicare is certainly the largest payer to hospitals and doctors. They're also not our best payer. So right now, the private sector already subsidizes the federal government by paying us more than Medicare pays us. So presumably, we're going to have to charge higher rates to the private sector to be able to stay in business.
Is it okay? So it's passed along. And I'm going to have to pay more.
Absolutely.
Okay.
Absolutely.
Now, what about those doctors who are out there on their own, small single doctor practices? They can't stay in business. They're going to start working for you.
They're struggling already. I mean, every report is about how private physicians are coming into hospital systems because the demands of treating Medicare patients and running their private practices, malpractice, it's just too much for them to take. And the trend is to bring them into hospital systems.
We've got about a minute left. And I know this is a big subject, but look, I'm interested in ways of getting the overall cost of medical treatment down. Is there one way that you could suggest to me now how you could do it?
Well, unfortunately, with healthcare, there is no single way. But I will say this. I think it starts with better educating the public. So with Obamacare, the White House did a terrible job selling healthcare reform to the American public. Representative Ryan from Wisconsin came out with a plan to privatize Medicare. He, too, the Republican Party, did a terrible job selling the privatization plan.
But you can't touch it, can you?
Well, you have to touch it. I mean, in 10 years, if we're not touching it or talking about it, we're doomed.
But what politician can say, you are going to take less for delivering the medical care that you deliver?
I don't think a politician can say you're going to take less. I think what a politician can do is explain to the public the consequences of the choices that we in America have made towards our healthcare system. Then and only then can we have an honest conversation, Republican or Democrat, hospitals and doctors, about what it's going to take to solve it. It's not going to get better until we do that.
All right. Well, we've got a congressman on in about 5 minutes, and we're going to ask him that question.
Ask him for me.
All right, I shall indeed. Andrew Rubin, thanks very much indeed. Always a pleasure to have you with us.
Good to be here.
Okay.